Welcome to Adapt NCLEX. The NCLEX love prioritization. And now they're doing something they call it integrated critical care prioritization. When they give you a case study, which is basically prioritization, 6 cases in one, and they test your knowledge how to prioritize. Don't worry, don't freak out. Those freaking out, this video is for you. Watch it, and when you watch it, you'll master this. I'm going to teach you how to do this NCLEX prioritization with these high yield questions, find critical finding with each patient, who to see first, and nursing intervention, and how to approach this case study. And let's get to it. Don't worry, there will be 6 scenarios. Just pay attention to it. Pay attention and make a diagnosis. That's the strategy. You have a face patient. Don't worry about it. No matter what they present, think about it as one single patient, 70-year-old who is vomiting, right? Bright red blood, heart rate of 140, blood pressure over 78 over 42, pale and cold skin. Do you think this patient is stable or unstable? This patient is in trouble. That's number one. Client B, 65-year-old with pneumonia, temperature 104, bad problem, blood pressure 82 over 50, and he has what? Fluid not responding with the blood pressure, refractory hypotension at rate of 128 and the lactate of 5. That is severe sepsis with what? Acidosis, bad problem. 45-year-old, sudden onset of what? Shortness of breath, chest pain, saturation 85 on roommate with the heart rate of 136, respiratory of 38, and anxiety, bad problem, respiratory issue. This guy is also in trouble. What is the problem? 26-year-old female who's 2 days postpartum. What is the problem? Severe headache, blurred vision, hypertension, reflexes high, epigastric pain. This is bad problem in associated with postpartum patient. You see what they're doing? Good cases, good prioritization, but they put them together. You just have to deal with them and handle them the way you would do if you're taking care of patient. 50-year-old, confused, found post-ictal after seizure, and he just had seizure again. In what? Emergency room. His sodium is what? 118. Like I told you, they can be terrible, they can be disturbing, but that's the case they will give you. Six-year-old is a boy, peanut exposure, swollen lip and tongue, right? Oxygen saturation 82 with the stridor, wheezing, and what? Heart rate of 150. The best way to answer these questions is to make diagnosis of each of them, know what each patient is suffering from. Number one, based on what you can see, you can tell that is in trouble. What is the problem? Is in shock. Is in shock. Hemorrhagic shock from what? Vomiting blood. B is also is in shock, but this is a form of sepsis, septic shock. 3 as what? Pulmonary embolism. This is what I call buzzword. They're taking the cues and putting it together and coming out with the diagnosis. Sudden onset of shortness of breath, chest pain, heart rate that high, anxious, and tachypnea. This is pulmonary embolism. 26-year-old who is postpartum and has neurological symptoms, hypertension, epigastric pain. This look like what? Pre-eclampsia. We have trouble, postpartum, pre-eclampsia. What is the problem? 50-year-old found confused, post-ictal. Look at the sodium, 118, now had a seizure again, severe hyponatremia, and New-Onset seizure. And the last one, F, you know this is anaphylaxis. 6 patient. If you are in the emergency room, put yourself in the emergency room, and all these people show up. What do you think? What are you going to do? This is the way they're presenting the case. It's a prioritization case study. If you hate them, you know you're going to pass the exams. What is the first question they're going to ask you? Identify all critical findings that need immediate intervention. They don't tell you anything, but they said, look at each patient and said, which of the information we provided you need immediate intervention? What do you think? First patient, which of these information need immediate intervention? That's all. If you see this patient, of course, his age doesn't matter. His sex doesn't matter. His vomiting, that's a problem. I got to protect him, right? His heart rate is 140. That's a problem. Blood pressure is too low. That's hemorrhagic shock. And the pale, cold skin is associated with that. I'm worried about him vomiting and having tachycardia and shock. These are signs of shock. I'm going to circle that. I'm going to pick it. It's a selected apply. So pick all findings. If you think it's good, you pick it. This guy is in trouble. He's in hemorrhagic shock. So I'm going to pick those things. Next one. What is the problem? 65-year-old. Pneumonia, right? Pneumonia is not a problem. The temperature is too high. The blood pressure make me worry. It does not respond with fluid. This is refractory, okay? Refractory hypotension. That will get you really, you die so quickly because there's nothing we can do if you don't do something. Tachycardia. And the presence of lactate of 5 means severe acidosis. His saturation is 90 in room air. I think it's okay. He's maintaining his own. But those that have underlying problem. Now, client C, what do you think? Sudden onset of shortness of breath, chest pain, saturation is 85, heart rate of 135, tachypneic and anxious. Which of these will you pick? You can pick all of them, or you pick those that you're 100% confident. Of course, tachycardia is not good. Tachypnea is not okay. And the presence of chest pain and sudden onset is a problem. Anxiety, I would say, is all related to this problem, right? Heart rate, tachycardia, shortness of breath, and chest pain is associated with it. Is saturation at 85 on room air, it's still maintaining a little bit. You cannot pick everything. But this is the thing. You got to pick your poison. They're trying to trick you. They said all critical findings that need immediate intervention. If this guy is on oxygen and his sat is 85, I will worry. But he's in room air. If I give him oxygen, he may probably do better. So those are the things you pay attention to. Client D, 26-year-old, 2 days postpartum, severe headache, blurred vision, hypertensive, and epigastric pain. All of them are bad. With hyperreflexia, we have a problem. This patient is in trouble. He's going to have seizures. We got to do something right away. And so if they said I should pick, well, severe headache, all the neurological symptoms are bad. And hypertension is not great for this patient. Critical findings. So these are critical findings you have to pay attention to. 50-year-old post-ictal after seizure, it's okay. But sodium of 118 and seizures witness, those are a bad problem that I need to follow up or need immediate intervention. The sodium and just had a seizure. And as you can see, you're following the trend. This is what they're doing. You have to pick your own. They're not telling you. You're highlighting them. 6-year-old boy, peanut exposure. Now, the lips and tongues are swollen. Saturation 82. Stridor, wheezing, heart rate. All of them. Airway is going to collapse. I'm worried about them. So I got to worry about your tachycardia, wheezing, your stridor, your saturation, and how your lips is swollen. These are the things you have to identify to make them know that you know this patient is sick. This is what? Risk reduction at the same time what? Physiological adaptation. That's why prioritization is very important. And this is the way they're presenting prioritization in order to fool you. But you already know it. In order to make you, this is how they're presenting prioritization in order to make you confused. But I know you can do it because you watch a doctor class. These are the key information you need to know. Now you have identified all the critical information. You are not done yet. Match clients with appropriate intervention. Now, what are you going to do for all these 6 patients? They're trying to let you think as if you're already working as a nurse. You have 6 patients. They all have other things to deal with. What do you do with each of them? You have different orders for them. Which patient do you see first? Well, that's what they're trying. So we have the 6 patients. I put all of them here. The one vomiting blood, who is on what? Hemorrhagic shock. What do you think he needs? IV hypotension, IM epinephrine, what? IV magnesium, IV norepinephrine, 2 large bowl, IV, and prep for what? Blood transfusion or start heparin infusion. What do you think? Hemorrhagic shock, bleeding because I'm vomiting blood. What would you give the patient? Bring your content. And you know this patient need blood. So client A need blood. Client B, pneumonia, septic shock, refractory to what? Fluid. Any patient who is refractory to what? Fluid, you need to start squeezing. That's what I call it. You fill the tank and you squeeze. Filling the tank is giving them fluid. You get to a point, the blood pressure will not respond with fluid anymore. It's time to squeeze. Which of the following can you squeeze? Can you use to squeeze? Is it hypertonic saline, IM epinephrine, magnesium, norepinephrine, or heparin? And you know that we have to give client B IV norepinephrine. Process. Client C, that's what? Pulmonary embolism. What is the treatment for that? You know we need to give them heparin. Client D, that's what? Postpartum, what? Pre-eclampsia. It's going to have seizures. What is the treatment for pre-eclampsia? You see, these questions, they are not difficult if you pay attention to what you know. And then you just answer it. The way they present it is just disturbing, but don't worry. Hold your ground. Adapt NCLEX got you. This patient needs what? Magnesium sulfate. And E just had a seizure, right? Because the sodium is too low. What do you need? Hypertonic saline. And the patient who have anaphylaxis, you know you need epinephrine, right? You need oxygen. You got to protect the airway. That's all, guys. You got it. Match client with priority intervention. That's what we need to do. Third question can be intimidating. Place client in order the nurse should see first. Who do you think we should see now? You already know who needs to be seen first. You know their problem. We have a patient who is vomiting hemorrhagic shock. We have a patient who is in sepsis, right? Septic shock. We have a patient who has pulmonary embolism. We have a patient who have what? Postpartum pre-eclampsia. We have a patient who just had seizure, right? And his sodium is low. And we have a patient who has anaphylaxis with the lips, tongue, all swollen. Forget about the picture I've done. Forget about the diagram I've done. This is the way so that you can see what I'm trying to see, so that you can see the movement of what is going on. That's why I present it that way. But forget about it. If you write all of them down, A, B, C, who do you think, if you have 1 second, you will give it to? Be sharp. I said what? Be sharp. Okay, about breathing, electrolyte shock, sepsis, airway, right? And then deal with the individual who is in trouble. Of course, patient who is anaphylactic will go first. No more. The F is the first patient we'll see. Now, this is the trick. You have a hemorrhagic shock patient A, you have septic shock patient, and then you have pulmonary embolism. There's a trick here. Client A and client B and client C can go either way, but there is the best way you can see. You can figure out. A, look at the blood pressure. It has basically refractory shock. It's gone. If you don't do anything, it's dead. Client B is getting there. Refractory shock because it's not responding to fluid. Client C, even though he has pulmonary embolism, there is no evidence. I've not given you the blood pressure. That the blood pressure, if I give you blood pressure and the blood pressure is low, we have collapse of the cardiovascular system. That patient become a priority. But look, his saturation is 85. He's maintaining his saturation. Therefore, A is more dangerous. Is more dangerous than B and C, followed by C, who is what? Refractory, before we can deal with 4. I know some people will say ABC. That's why ABC does not work. Always look at the scenario. Just because he has pulmonary embolism, it should be. In this situation, the information I've given you is doing okay. It's not gone yet. The saturation of 85 from room here make me happy. But if he is on oxygen, 4 liters, and he's citing 85, that tells you we are in the other problem. Then you know, post-ictal patient is the last patient. He already had seizure. You just have to protect him. But patient who have pre-eclampsia is more important than patient who already has seizure. This is the prioritization they're giving you. And you can see this is straightforward. Adapted schedule. Watch this video multiple times to know the strategy, hold your ground. Now, arrange generalized clinical priority across all clients. This is the question they asked. This is not the same case study, but the questions they asking, this is what it looked like. I believe question 4 was the hardest of all. Prioritization. And they tell you these are generalized clinical priority. One is GI bleed, septic shock, pulmonary embolism, postpartum eclampsia, new seizures, and anaphylaxis. These are the priority they give you. This is what they give you. Provide education, neurological decline, support circulation, stabilize air or breathing, initiate condition-specific therapy, manage electrolyte or metabolic imbalance. If you see this question, forget about the left side. Otherwise, you go wrong. They've given you what you need. They say these are the priorities you need. Forget about the case, the GI bleed, sepsis. No, if I need to provide what? Education, is the more important than neurological decline? Is neurological decline more important than support circulation? Is support circulation more important than stabilized airway? It's like muscle, basically in a different form. So forget about the left side of the track and look at the right side. Which of these will you do? Provide education, neurological decline, support circulation, stabilize airway, initiate condition-specific therapy, and manage electrolytes. What do you think? 6 interventions. Which one is the most important? And as you can tell, if I have to stabilize the airway, I'm doing a writing. I'm prioritizing like adapt and closeness. So pay attention. We need to do that one first. What do you think is the second one? Do you educate the patient? You know, muscle, you're not supposed to do that. That's the last thing you do. Neurological decline, it can be dangerous. Supporting their circulation. If there's no blood flow, they're dead, right? Electrolyte, you want to control electrolyte? Which one? Watch B sharp. B sharp is adapt and close way of doing prioritization. All these questions are just saying, oh, this is all B sharp. You got to worry about breathing, electrolyte shock, sepsis, airway breathing. But what do you do first? Which one is going to kill the patient? The next one is supporting their circulation. Then worry about neurological status because that can affect their airway. Then 4, control the electrolyte. And 5, whatever disease-specific condition they have, you fix it. And then 6, provide education. I think this was the hardest portion of the question. Like I said, the question stem is that, but not the case. I'm creating this case. But you have to be comfortable to be able to master this question. Number 5, match the client with the most appropriate short-term outcome. Now they're telling you we've done something for them. What will be the short-term outcome for each individual patient? You know them. Let's review them again. These are them. Client A, he has what? Hemorrhagic shock from vomiting, blood. Client B has pneumonia, sepsis. Client C has pulmonary embolism. Client D has postpartum pre-eclampsia. Client E is confused because he has hyponatremia and what? He had seizures already. And client F, anaphylaxis from peanut. What do you think is the short term? Who need to clear the airway? No stridor, and no oxygen saturation. We want to improve oxygen saturation greater than 95. Who do we have a seizure free and his sodium? We want to make sure his sodium is 125. Who do we have to prevent seizures and make sure the blood pressure is low? Who hemoglobin we need to improve and make sure the vitals are stable? Who do we need to ensure saturation is 92% and there's no chest pain? Who MAP need to be greater than 65? That means blood pressure is normal and lactate is improving. These cases, don't freak out. Ask yourself, you know the case. Who is having airway issue? Let's go from the top to down. Client A is vomiting blood and is in hemorrhagic shock. What should be our short-term goal? Is to improve the hemoglobin and make sure the vitals is stable. And so that's the one. Patient who has what? Septic shock and his lactate is 5. Well, I got to improve his lactate and make sure MAP is okay, and that is client B. What is the problem? Patient has what? Shortness of breath. We know he has pulmonary embolism, client C. What are you going to do? It's not the airway problem, it's a breathing problem. So we got to make sure the saturation is fine and there's no chest pain. That's that one. And if you have postpartum, pre-eclampsia, we got to what? Prevent seizures, no seizure free. So that one. And if you already have seizures and your sodium is low, I need to improve your sodium. And if you have anaphylaxis, I got to prevent the stridor. And this is the way you have to do it. It can be confusing, but this is what intervention and the client. And these are the clients. So client health need to clear the airway, no stridor, and saturation greater than 95. But that is our short-term goal. And the last question. This one is interesting because it's all the things you know. You take each client and figure out whether instruction we're providing is appropriate. This is client 1. Client A, GI bleed. Should they avoid NSAID? Should they avoid alcohol? Should they take their PPE and follow up with endoscopy? Think about it. Client B, septic shock. Should he continue with the antibiotic and report any fever and chills and get vaccination? Client E, he has PE. Should he take his anticoagulant, monitor his bleeding, and avoid prolonged immobility so that he doesn't get a PE again? Client D, he has pre-eclampsia. Should we check the blood pressure daily, report any headache and vision change, and follow up postpartum? And client E, who has hyponatremia, probably SIDH, should we restrict fluid, monitor the sodium, and then seizure precaution? And the kid who had anaphylaxis, should we teach them how to use epinephrine and avoid allergy and wear allergy bracelet? You see, all of them are right. A good teaching is a select or apply. If you think it's appropriate, you select it. If you think it's not, you leave it. But this is a trap, right? You can see, how can I select all the answers? Well, they are right. I told you, if you are 100% sure, you pick it. If you're not, leave it. But these are all right answers. I intentionally give you right answers. So pick them. If you think it's right, pick them. Don't shy away. But if you're not sure, then you can leave. All of them are right. These are what we call integrated critical care prioritization, NCLEX prioritization using NCLEX practice questions, case study, and putting all of them together, learning nurse intervention for your NCLEX and nursing exam prep. You need to watch this video multiple times. Don't get freaked out. Don't get scared. You'll be fine. Adapt NCLEX, get you back. Thank you. And if you like this video, put a comment. Tell me where you have confusion. And then let me know where you're struggling. This is the video you want to watch before you go and take the NCLEX in case you see that again. Take care of yourself and good luck. I have a bunch of videos on my channel on case study. You can type case study and you see 4-in-1, 5-in-1 case study. I've been doing this case study a long time ago. So you should watch them so that when you go take the test, you don't have a problem. Thank you.